to update you on the current developments. Thank you.
Thank you, Mr. Chairman. My colleagues on the PTF team, distinguished ladies and gentlemen, as at today, 21st April 2020, a total of 665 people in 24 states and the Federal Capital Territory have been confirmed to have COVID-19. The 38 new confirmations are distributed as follows: 23 in Kano, 5 in Gombe, 3 in Kaduna, 3 in Borno and Abia, 1 in FCT, Sokoto and Ekiti. We have recorded 22 deaths and 188 people have recovered from COVID-19 and have been discharged from hospitals. The National Rapid Response Team supporting the COVID-19 response in each affected state and 23 rapid response teams have been deployed. With the community transmission, we are doing active case search in communities, and this strategy requires more testing kits and diagnostics. Currently, we are assessing additional laboratories for accreditation and will announce more laboratories soon. We have 13 so far. We have intensified efforts in risk communication at grassroots level. The need to avoid mass gatherings without protecting yourself cannot be overemphasized. The use of face masks or face barrier that covers your mouth and nose has been scientifically proven to reduce spread of respiratory infection. I therefore urge all Nigerians to practice hand and respiratory hygiene, avoid mass gathering, and put on a face mask at all times, particularly when you leave home. The improvised cloth mask will suffice at community level. And in this regard, we advise you do not use nylon material or polyester material. The improvised cloth mask, which I've just referred to, will go a long way to help our people. Please always wash and iron at the end of the day. That is when you use improvised face mask. I urge all Nigerians to make this sacrifice for all of us and for our loved ones. Together, we shall not only stop the spread of the virus, but we will defeat COVID-19. Let me continue to thank our health workers for the good work they are doing and the sacrifices they are making. Nigerians are grateful and say a big thank you to you all. I also want all our health workers to be extra vigilant and ensure they protect themselves as they do their jobs. We shall strive as government to ensure we provide you with all the necessary personal protective equipment required to do your work. For all Nigerians, please call the NCDC number if you suspect you have any of the symptoms or you think your neighbor has the symptoms. Stay home, stay safe, and take precautions. If you must leave the house, practice physical distancing, hand and respiratory hygiene, and put on your face mask. In solidarity, we shall conquer. Thank you very much.
The Secretary to the Government of the Federation, Honorable Ministers, members of the Presidential Task Force, and ladies and gentlemen of the press, good afternoon. Today I will re-echo what the Honorable Minister of State Health has said with regards to face masks. We continue to urge you to use face masks as an optional addition to the routine measures of physical distancing, avoiding mass gatherings, and respiratory hygiene. In line with the NCDC face mask policy, we advise Nigerians to make DIY, do-it-yourself face masks. Not only are they cheaper, but they are also more colorful, as we can see from the chairman's mask. We do recognize the Nigerian creative enterprising spirit already at work, with so many people already making use of local fabrics. We'd like to urge you to continue to adopt all procedures for improvised mask usage and maintenance based on the NCDC guidelines. With regards to state engagement, we continue to engage collaboratively with state governments on the pandemic response. The task force will continue to provide necessary assistance to states to ensure adequate sensitization. In this regard, we would like to acknowledge and thank both the public as well as the private media for the support they have been providing in terms of information and education materials on TV, radio, jingles, etc. With regards to vulnerable groups, we would like to confirm that the PT response activities do include vulnerable groups, including people with disabilities, the elderly, etc. And we will continue to work with the Ministry of Humanitarian Affairs to ensure palliatives reach them. After all, we are one nation, and we need to ensure that vulnerable members of society are taken care of, especially in these difficult times. We do note the concerns about increased reporting of cases. We are closely monitoring Kano, Osun, Oyo, and Edo. We note the particular concern with Kano, and we have engaged closely with the state government. Because we are increasing the number of tests as we ramp up, there is a possibility that we will continue to have more and more cases coming in. Finally, I would like to re-emphasize the need for complying with the lockdown policy, particularly for those two states of Lagos and Ogun, as well as the FCT. I would like to urge Nigerians to please stay at home. If you do have to come out, please ensure that you respect the physical distancing and avoid mass gatherings, as well as using your face masks.